Good evening to you. Good evening, Bermuda, and happy birthday to Director Wilson, who has a day off as she's celebrating her birthday today. And so, Director Wilson, thank you so much for your hard work, and we'll see you back here next week. Bermuda, this week, as we plan to celebrate our island, our heritage, and our history on Bermuda Day, we can also take pride in the progress we are making against the coronavirus and our collective work to move beyond the pandemic together. Our goals remain to be able to eliminate local transmission, protect our country from dangerous variants, and continue to progress our vaccination program. There is still work to be done to reach and to maintain those goals. However, we are turning the page and beginning a new chapter with new tools at our disposal and renewed energy to reclaim our summer and our island from the grips of the pandemic. Through new technology in the SafeKey program, we can stay one step ahead and begin to enjoy more activities such as indoor dining while reducing the risk of spreading the coronavirus. Tonight, the Minister of Health, the Honorable Kim Wilson, will provide the country with an update on the latest coronavirus test results, vaccination certificates, including this weekend's record mobile vaccination numbers. Following the minister, I'll provide an update on the amended public health regulations, which will allow for indoor dining through the use of SafeKey and other matters. First, we will hear from the Minister of Health. Minister?
Thank you, Premier, and good evening to everyone. The Ministry of Health received 927 test results since the last update, and none were positive for COVID-19 coronavirus. This gives us a positivity rate of 0.0%. Additionally, since the last update, there were 15 recoveries and no deaths. There are currently 42 active cases, of which 40 are under public health monitoring and 2 are in hospital with 1 in intensive care. Since March 2020, Bermuda has recorded 2,490 total confirmed cases of COVID-19. Out of those, 2,416 persons have recovered, and sadly, 32 persons have passed away due to COVID-related deaths. The source of all cases is as follows. 302 are imported, 2,156 are classified as local transmission, of which 1,675 are local transmission with a known contact or source, and 481 are local transmission with an unknown contact or source, and 32 are under investigation. As investigations proceed, transmission categories may change. The 7-day average of our real-time reproduction number is less than 1. Bermuda's country WHO current status remains at community transmission. The numbers of confirmed positive cases continues to decrease. And after a very long year of battling the coronavirus, things are improving. Bermuda is making very good, steady progress, and we are slowly getting back to new normal. I would now like to provide you with an update of our vaccination program. We have completed the 19th full week of vaccinations from January 11th until March 22, 2021. Bermuda has administered a total of 68,104 vaccinations, and that figure rises to 68,822 if you include vaccinations administered between Sunday, May 23rd and Monday, the 24th. All very, very well and excellent news. Of the 65,104 vaccinations administered for the period that we are reporting on, which ends on May 22nd, 52% are women and 48% are men. 77.6% of all residents over the age of 65 have had at least one vaccination, with 72.4% being fully immunized. Last week, I reported 79.9% of all residents over the age of 65 had at least one vaccination. However, the corrected number is 76.36%. To date, 55.7% of the population has been vaccinated with 1 dose, and 50.5% of the population has been immunized, namely 2 doses. Again, we are making significant progress vaccinating our residents. And I encourage everyone who wishes to be vaccinated to do so as soon as possible. You can get vaccinated at the Bermuda College, which is open Monday to Friday from 9 a.m. until 1 o'clock p.m. for walk-ins. You can also make an appointment to get vaccinated at the Bermuda College between 11 a.m. and 1 o'clock p.m. However, the Bermuda College is not open for vaccinations on the weekend. The Bermuda Hospital Board Vaccine Center is open from 8 a.m. until 8 p.m. for anyone with an appointment. And this is especially convenient for people who are working during the day or who need an appointment in the evening or on the weekends. And they will be accepting walk-ins this Saturday and Sunday. Again, that's at the Bermuda Hospitals Board. This Saturday and Sunday, you can go to the Bermuda Hospital Clinic, Vaccination Clinic, as a walk-in on Saturday and Sunday. This week, the Close to Home COVID-19 mobile vaccination program will be at the following locations. Thursday, the 27th of May, it will be at Sands Secondary Middle School between the hours of 4 p.m. and 7 p.m. And on Saturday, May 29th, at the National Sports Center between the hours of 10 a.m. and 2 o'clock p.m. At the National Sports Center on Saturday, vaccine certificates will be provided to those who do not have internet access. Also, 200 free meals will be given away from the caterer Kenny's Kitchen, thanks to the generous donation of Red Laser Limited. There will also be other participants that will be joining in Bermuda's objective of community immunity, and will be giving out gift cards and vouchers to those that get vaccinated on Saturday at the National Sports Center. And I would like to thank Auto Solutions, who will be donating free car wash vouchers, and Front Lounge Foundation, who will be donating gift cards from various businesses throughout the island to all those members of the community that show up on Saturday at the National Sports Center, Saturday the 29th of May, to get vaccinated. We are reaching a milestone, Bermuda, as there are 2 weeks left to assure yourselves of 2 doses of the Pfizer vaccine. Next week, the mobile vaccination locations are as follows: Shelley Bay Marketplace on June 1st, T.N. Tatum Middle School on June 3rd, and Victor Scott Primary School on June 6th. The Close to Home mobile vaccination neighborhood sites are for people who have not yet registered for the COVID-19 vaccine, do not have access to the internet, and prefer to register in person, or have additional questions about the COVID-19 vaccine. There will be doctors on site to answer any questions that you have, and you do not need an appointment. You can just show up and roll up your sleeve. We recommend the Close to Home Mobile Initiative program as an ideal opportunity for those persons who want to learn and hear more about the COVID-19 vaccine from a trusted source. And if you need a free ride to any of the vaccination sites, call 533-5903 between 10 a.m. and 1:30 p.m. and minibuses are available to take you there and bring you back home. Since the mobile vaccination program began on the 27th of April, a total of 1,729 vaccines have been given as of May 24th. And about 78% of those injections were administered to people receiving their first dose. Thanks very much to the Bermuda Health Council and the Royal Bermuda Regiment, who have been assisting the Ministry of Health with this program. And thanks to all of the healthcare workers and stakeholders who have been assisting with our mobile vaccinations. If you need assistance getting vaccinated or simply have questions, please contact vaccine@gov.bm, or you can call the hotline at 444-2498 and select option number 2. The vaccine call center is available from 8 a.m. until 4 p.m. Mondays to Fridays, and Saturdays from 9 a.m. to 3 p.m. And the call center is closed on Sundays. As I've mentioned previously, Bermuda's current supplies of Pfizer, BioNTech, and AstraZeneca expire on the 30th of June. The Pfizer vaccine requires 3 weeks between doses. This means that the first dose can be given on June 8th, which is fast approaching. To be assured that you can receive 2 doses of the Pfizer vaccine, please either register for an appointment at gov.bm or attend the walk-in facility at the Bermuda College, or attend one of the Close to Home locations, again, before the 8th of June. Yesterday was a monumental day for Bermuda. To ensure that we limit vaccine wastage, 9,000 doses of AstraZeneca vaccine were delivered to the Republic of Trinidad and Tobago on a private flight. Our neighbors in the South have had some challenges with retaining sufficient supplies of vaccine, and I am proud of how the Bermuda government and the community joined together to support Trinidad and Tobago, as we believe it is a win-win for both countries. The AstraZeneca vaccine can be administered up to 12 weeks after the first dose. Therefore, the first dose can be given up until the 30th of June, with the second dose administered from a new batch of vaccines received from COVAX. There is currently enough COVID-19 vaccines available in Bermuda for anyone who wants to be vaccinated. Once the existing batches of vaccines have expired, more will be sourced in the coming months. For those who wish to get the vaccine of Pfizer now is your time. There are no guarantees of when Bermuda will be getting more doses in the immediate future. Those parents who are interested in having their children vaccinated can register their appropriately aged children on gov.bm so that the Ministry of Health can gauge interest in being vaccinated. And as I mentioned last week, the Food and Drug Administration and Health Canada have both approved the Pfizer vaccine for children ages 12 to 15 years of age. However, as the Memorandum of Understanding between the Bermuda Government and the Foreign Commonwealth and Development Office in the United Kingdom specifies that this vaccine can be used only for people over the age of 16. Bermuda and other territories are facing the same challenges and continue to wait for the Medicines and Healthcare Products Regulatory Agency, or the MHRA, to approve the use of the Pfizer vaccine for the age group of 12 to 15-year-olds. This is an issue that we are still working on resolving before we can begin to administer the vaccine to that lower age group. On a final note, tomorrow at 8:00 p.m., we have a panel of experts who will explain how the COVID-19 testing works, and they will share the research about giving the COVID-19 vaccine to those persons 12 to 15 years of age. On the panel will be our own Chief Medical Officer, Dr. Ayo Olenye, Dr. Karika Weldon, Dr. Ramon Arscott, epidemiologist Ms. Dewan DeRosa, and pediatrician Dr. Sylvanus Nawab. They will debunk myths and answer any questions from the public, so I encourage you all to tune in and ask your questions. This informative program will air live on the Bermuda Government's Facebook page, CITV, and YouTube, again tomorrow at 8:00 p.m. Please remember, Bermuda, each of us has our part to do to stop the spread of coronavirus. It is essential that we follow the public health guidelines, we wear a mask, we practice good hand hygiene, we maintain physical distancing, and we download the We Health Bermuda app. Do the research, talk to your doctor, and make an informed decision about getting the COVID-19 vaccine. Stay safe, Bermuda, and don't forget to avoid the 3 C's: closed spaces, crowded places, and close contact settings. Thank you.
Thank you, Minister of Health, and thank you to your team for the work that you continue to do in this country's battle against the coronavirus. Thank you as well to the doctors, the nurses, the Bermuda Health Council, the Royal Bermuda Regiment, and also the support staff from the Ministry of Public Works, who all helped to make this weekend's mobile vaccination program a resounding success. All of the individuals and teams involved did an excellent job ensuring all of those who wanted to receive their first or get their second shot received it. Thank you to those Bermudians who turned up in record numbers this weekend to get vaccinated and to take our country a step closer to community protection. The government remains committed to making the vaccine accessible to anyone who wishes to get it. And whether you're in the east, central, or west of the island, mobile vaccinations are coming your way this week. While we continue to move towards community protection, there is still the need to protect our island, and particularly our healthcare system from dangerous variants that continue to affect other countries around the world. It is with this in mind, the government will implement the mandatory supervised quarantine for all non-immunized travelers beginning on June 6th. I've often said that Bermuda cannot afford another stay-at-home period or the tightening of restrictions on economic activity. This remains the case, and all of our efforts are designed to ensure that we will not go back to that. We continue to work on providing the best framework for the required quarantine of unvaccinated travelers arriving into Bermuda. As the public debate indicates, these are sensitive issues, and the government is determined to achieve the correct balance. We are also determined to respect individual rights while keeping Bermuda safe from the threat of variants and the ongoing community transmission in those gateway cities with direct service to Bermuda and beyond. Like most aspects of the pandemic, our thinking must be centered on the public health concerns as well as the unenviable requirement to adopt policies that are not popular. There is a steady increase of vaccinations locally, and even the staunchest critics are coming to understand of the need to protect their fellow citizens from what remains a potentially harmful, or as we've seen in the last few months, potentially deadly disease. We will keep working on the operational aspects of the policy and will do so sensitively, prudently, and in the best interest of the people and the economic recovery so desperately, desperately needed. While we protect ourselves from variants from abroad and continue to eliminate local transmission, there is a need to stay one step ahead of the coronavirus and to get more Bermudians back to work. Last night, Her Excellency, the Governor Reina Lalji, on the recommendation for the Minister of Health, signed into law amendments to the public health regulations to permit indoor dining with the use of SafeKey. There will be further amendments made imminently to add churches to the increased capacity, as we mentioned last week in the press conference. But there was a drafting issue which was resolved earlier today. Licensed restaurants are now permitted to open for indoor dining so long as they ensure all patrons are in possession of a valid SafeKey. SafeKeys are QR codes which are being issued to fully immunized persons along with their upgraded vaccination certificates. Both documents are downloaded PDFs, which a person can print or keep on their portable electronic devices, such as a phone or a tablet. Licensed restaurants will also need only to have a portable electronic device, such as a smartphone or tablet, with a camera capable of scanning the QR code or the COVID SafeKey on verify.gov.bm. Local businesses and app developers have continued to reach out for information on how they can integrate SafeKey into their own apps or systems. And this information can be found on the website gov.bm/SafeKey. It's important to remember that you do not need a vaccine to participate in the SafeKey program, and you can also do it by getting a negative test at any of the public testing facilities, which are free in Bermuda and readily available. When a patron arrives at a restaurant, the restaurant must scan their COVID SafeKey and check that their photo identification matches the information on the SafeKey. Verify.gov.bm will show their initials and the month and day of their date of birth and a green check if the SafeKey is valid. Restaurants that do not check the SafeKey and ID of persons may be subject to closure by the Minister of Health. There was a slight issue earlier where some valid QR codes were showing up as invalid. That issue has now been fixed. It is important for both the restaurant and patrons to note that the same rules apply to indoor dining as with outdoor dining. No service permitted at the bar, no more than 6 persons at a table, tables must be placed 6 feet apart, and persons can remove their masks while seated, certainly, but if they're getting up to go to the bathroom and walking through the restaurant, they must wear a mask. Persons can dine indoors once in possession of their SafeKey, either through being fully immunized or testing negative. SafeKeys are being issued via email in PDF form and can be printed or downloaded and kept on a phone or a tablet. It's important to note that to access places, you must have photo identification with you to make sure that a restaurant or establishment can validate your SafeKey. The government appreciates the growing interest in SafeKey for individuals and businesses alike. Many are eagerly awaiting the receipt of their SafeKey and have contacted my office to ask if they can apply. Those who have not yet received their SafeKeys, please be patient and be aware that you do not need to apply if you have been fully immunized. And that means 2 weeks after your second shot of the Pfizer-BioNTech vaccine, or if you elect to get the AstraZeneca vaccine 2 weeks after your second shot of the AstraZeneca vaccine. The Ministry of Health has already issued 13,410 emails as of an hour ago containing the updated vaccination certificates and SafeKeys, and they will continue to issue more this week until we're expecting at this current pace, no later than Friday, all of the persons who have been fully immunized would have been issued this SafeKey. It is important to note that if you receive your link for your SafeKey and you share it with another individual who has not yet received that email, the link will not work for them. They are individual links to individual persons, and the emails are certainly coming to the email that you registered with when you registered to make an appointment for the vaccine. There are persons who are fully immunized who have received both doses of the vaccine and are 2 weeks apart should look out for an email from Bermuda Government and with the subject, Government of Bermuda COVID-19 Vaccine Certificates. The email will be sent to the email address which was provided at the time of the registration for the vaccine. All you have to do is click the link that is at the bottom of the email to verify your information, and you'll be upgraded and you'll be issued an upgraded vaccination certificate accompanying with a SafeKey. And it's very important because a few people have written in and said, oh, I went to verify.gov.bm and I scanned my SafeKey and all of my information came up, my full name, my date of birth when I got it. And it's important that that link that comes up has both your vaccination certificates, and it says at the top, scroll down to find your SafeKey. If you scroll down, there's a separate PDF document that is the SafeKey. So you will get issued 2 documents. One is your vaccination certificate, if you need to travel and to make sure you need that. So anywhere you're going, if people need a proof of the vaccine, or the SafeKey, which is issued for persons who have been fully immunized or persons who receive a negative test. So in the exact same way, if you get a negative test and you get that email, you will have your negative test certificate at the top, and below that negative test certificate, you'll also have your SafeKey, which will enable you to enjoy indoor dining. If you are not 2 weeks past your second shot of the COVID-19 vaccine, you will not receive an email for SafeKey at this time. Any persons not fully immunized can still enjoy indoor dining by booking a coronavirus test, and your negative test result email will also include the PDF, including your SafeKey. The resumption of indoor dining will allow for hundreds of Bermudians who have been unable to work during the pandemic to return back to work thanks to the implementation of SafeKey. The safe return to normal operations for local businesses is an essential first step to Bermuda's economic recovery, and the first step as we turn the page to a new chapter on our journey beyond the pandemic. SafeKey is necessary to allow for more activities while we are in phase 2 to reduce the risk of spreading the coronavirus, but it will not be necessary forever. And so I've heard some complaints about saying, why do I have to get a test every 3 days to have indoor dining? And this is crazy, and when will it end? Well, it will end when we move to phase 3 and indoor dining is open and available to everyone. But while we still have cases of local transmission, while we are still working to move past local transmission, it is important that we minimize the risk, and being at these certain places can increase that risk. When Bermuda eliminates local transmission, there will not be need for these restrictions for indoor dining that has a need to present SafeKey for those high-risk activities. And the only time that SafeKey will then be able to be used or necessary to use will be for large events such as Bermuda Day event, which we're having this month, county game this year, or cup match. SafeKey was designed with the protection of privacy for individual users at the forefront of its design. Minimal information is available through SafeKey with secondary checks for photo identification to ensure it is being used by the correct person. Beyond the issuance of SafeKey based on negative tests or persons being fully immunized, it is not possible to track someone's movements or otherwise using the SafeKey. And it's a very important point, and I want people to know and understand it. People have said that the government can track you using the SafeKey, and that is just not true. It is open source. The code is available for anyone to see. You can go to gov.bm/SafeKey, and you can recognize that it is not something that is dealing with the logging of information. And so it is perfectly understandable that people will have this fear, but I promise you that there is far more risk of being tracked inside of your cell phone or any of those apps that you have installed, which track your location, all the rest, than anything that is done by the government of Bermuda. These were things that we did. Thanks for the review with the privacy commissioner. We understand, just like We Health when we did it, where it has privacy in mind, where it cannot be tracked, and people are asking us the question, why can't you just, issue the codes? Why can't you tell us how many codes have been issued? Because it is privacy-based. And so we won't be able to tell how many people have been to a restaurant or certain aspects. But what we will do is there will certainly have to be spot checks because restaurants must adhere to the rules that you have to make sure that someone has a safe key and make sure that you check the photo identification to make sure it matches with that person so we're able to have these things open before we get to phase 3. With this new chapter of which we're moving in, it is also a brand new addition to our tourism product with the opening of the St. Regis Hotel, which is another addition and another chapter. St. Regis will not only provide world-class accommodations for locals and visitors, but a much welcome economic boost for the town of St. George. And it has and will continue to provide jobs for Bermudians. I had the pleasure of meeting many young Bermudians at St. Regis this past weekend, many who are in hospitality for the first time. And they are eager to welcome guests and be a part of Bermuda's world-renowned tourism industry. The weekend also saw a return of a much welcome sight off our shores, with the Viking cruise Orion sailing on our crystal blue waters to begin their Bermuda Escape home porting itinerary, with the first cruise leaving from Bermuda on the 15th of June. I thank the Minister of Transport, the Honorable Lawrence Scott, and his entire team for all of their hard work in making this initiative possible. Our tourism renaissance is well and truly underway, and we are continuing to do the work that is necessary to make Bermuda a must-visit destination to tourists from around the world, which will only benefit our local economy and local business. In keeping in that vein, the government has finalized a policy to encourage the group business that provides benefits to hotels and other establishments. Due to the COVID-19 pandemic, many venues have been unable to plan for group business. And there is no plan in place that allows venues to secure approval in principle for large social gatherings. And we recognize that the large gathering process can sometimes take a while, and that uncertainty makes it difficult for persons to plan events. To streamline the process around gaining exemptions for large group sizes and gatherings, hotels and other event venues are looking to implement a plan so they can secure group business and bookings. To date, these venues have lost a tremendous amount of business because there's no framework in place that allows them to promote their safe operations, which will meet all public health guidelines. Our aim is to allow venues to grow their market share in this area and continue to extend the recovery to additional sectors of the economy that depend on this business. Throughout all of the work being done within the government and by you, the people of Bermuda, we must also take time to enjoy our day as a country. As we celebrate Bermuda Day, albeit in a different fashion for the first time since 2019, it is thanks to our collective work, our collective Bermudian resilience, that we can enjoy celebrations that were not able to be held last year. We will utilize our new SafeKey tool to safely hold Bermuda Day Showcase at the National Sports Center and the Bermuda Day Half Marathon. We'll return to celebrating our heritage, which is truly indicative sign that we are beginning to reclaim our summer and our normalcy here at our island home. This week is a time for us to remember what unites us as a country rather than what divides us. It is a time for us to celebrate the uniqueness of our culture, the strength of our community, and the beauty of our island. And I wish everyone a safe and enjoyable Bermuda Day. With that, I'm happy to take any questions that members of the media may have.
Thank you, Premier and Minister Wilson. So as the Premier said, at this time, we will begin the question period, starting with Don Burgess from BBC. Just give him a moment. All right, Don, welcome. You are live and you have 4 questions. You may begin.
Good evening. Mr. Premier, there's a video that has been widely circulated from the opening of the St. Regis where there were more than 40 people out on the deck and most of them were not wearing masks, including yourself. It was outside and this was a SafeKey event which had been granted an exemption. Were any protocols breached and how do you respond to the criticism that the optics were poor?
I respond to the criticism of the optics report that I will accept that when there's a time where so many people are struggling to see what appeared to be a celebration. It was a formal event where there were speeches. And they took everyone out to the balcony for a champagne toast for the opening of the luxury resort. But I completely accept that the optics were not good. But what I can say is that we took great care to make sure that the event did not contravene the guidelines, and we made sure that we went through and issued safe keys for the invited guests. And those persons were immunized. So the guidelines were stated last week by the Minister of Health. We accept the fact that there is criticism, but the one thing that I can say is that it is about what the future will look like. We want to reclaim what our future is going to be this summer. We have done excellent work to get this far. And I think that it's important to note from the view in which, in the perspective which I sit, certainly, that we can look forward to having events in the future. Just like you said, we're rolling out the trusted event thing so we don't have to go through the very difficult process of large group exemptions, et cetera. The future will be I think it will be a different place. And so we're seeing the good results and we're planning towards the future. And hopefully we'll be able to move to phase 3 on June 6th. And as we're continuing to see, we'll be able to relax the guidelines. But it was a special occasion, certainly. And I was there. And without question, I think that it is something that should be celebrated because the opening of a luxury resort in Bermuda is something, just like the cruise ships that were coming in, is something that is to be recognized, is something that is a new chapter for the country.
Just to be clear, when a SafeKey event happens, that means then people can be as close as the people were seen in that video, because there wasn't 3 feet distancing between most of those people when they were having their conversation. So any SafeKey event, people can be that close to each other.
It's important that you recognize that the guidelines need to be followed on, and the Minister of Health stated the guidelines last week about fully immunized persons and where they can be. And so I'm not going to get into the people who were immunized. What I can say is that there was a list of attendees which were provided by the hotel. And when we ran those through the SafeKey system to make sure people were issued SafeKey, those persons were immunized.
Thank you. What can you tell us, Mr. Premier, about any incentives that government has plans to introduce to encourage people to take the vaccine, particularly as our current stock expires next month?
I'm not going to speak to that. I'll let the Minister of Health speak to that. But I think what's important to note is that the government is not offering any incentives. What the government is certainly saying is we were happy to support in the private sector and people who want to come along with what is essentially a community effort. And I think the Minister of Health had mentioned a few of them inside of her address. So I'm happy for the Minister of Health to speak at this time.
Yes, Don, there are a number of organizations that have come forward that wish to do their part in ensuring that we reach the golden numbers of community immunization. And the ones that I spoke about in particular today that will be donating some of the activities and the certificates for this weekend would be Red Laser, has donated 200 meals through Kenny's to be prepared by Kenny's Kitchen. The Frontline Foundation will be donating all types of gift certificates from restaurants, fun zones, nail salons, and the like, as well as the Auto Solutions will be donating vouchers for car washes. So as the Premier indicated, these initiatives are not being advanced by the government. They're being advanced by our good corporate citizens and our partners who also wish to see community immunization, oh my goodness.
Community protection.
Community protection. Thank you, CMO. Community protection. So we're thrilled that our partners are coming on board, and there's a number of other organizations that we anticipate will also equally share in this endeavor. Thanks, Don.
Right, thank you. By commendably giving away 9,000 doses of the AstraZeneca vaccine, is that a tacit admission by government that Bermuda will not vaccinate 70% of the population by the end of June? Because that leaves us with less than 80,000 doses.
I'm not sure if it's a question of tacit admission of anything, Don, but the fact is that the vaccination pace is slowed here in Bermuda as it's slowed in other places. And we want to waste the vaccine? No. I mean, we have enough supplies that we'll be able to offer vaccinations to persons who want them. But this is not a place where we're forcing vaccines upon anyone. We can't force vaccines upon anyone. What we want people to do is to speak to their doctors and to make the decision for themselves. And so there is a certain situation in Trinidad and Tobago, and the government was pleased to be able to go ahead and provide that to the government of Trinidad and Tobago. Bermuda is in an enviable position to have an overabundance where there are so many countries that are, dying to get additional vaccines. It's very, very important. And so from this perspective and from this aspect, we're pleased with it. We have the capacity to continue to immunize persons. After June 8th, there will be supplies of AstraZeneca where we can continue to immunize persons. And so it's not as though we're going to stop, but what we're telling everyone is if you want to get the Pfizer-BioNTech vaccine, the last doses are on June 8th, and we are encouraging as many people to come forth and go ahead and to do that.
All right, thank you. My last question tonight.
Actually, Don, that was your final question.
Okay, so the follow-up counted as a second question, then I take it.
It was a separate question. Thank you very much, Don. Enjoy your evening.
Thank you.
Thank you. So next up will be Good evening, Earl. You are live and you have your 4 questions.
Good evening. Mr. Premier, we have sports persons heading out for international duty over the next month or so. Some are unvaccinated for several reasons. Are they subjected to the government mandate of paying for a hotel because they are unvaccinated after representing the country and returning home?
The quarantine rules that are there certainly do apply to everyone. As difficult as it is to protect the country from the importation of dangerous variants.
Okay. I think I heard you mention Cutmatch and County in your earlier statement. Why are we not getting more information as time is running out for both of these events to be staged? And it's a big undertaking for both organizations to be prepared to host not only the game, but the public.
Don, what information are you?
We've done a game.
I'm sorry, Earl. What information are you? What information are you seeking?
Well, the public sitting here waiting to find out whether or not Cutmatch is on. What is going to be the availability of spectators? Same thing for County. Everybody's waiting, and we seem to be waiting and waiting and waiting. We're not getting any updated information. And if we're waiting, I would only imagine that the organizations are waiting themselves.
Well, I'm not entirely certain if that information is supposed to come from the government of Bermuda, Earl. So all I'm going to submit it. I know that the government continues to work with committed. I know that the government continues to work with persons. I do recognize the provisional approval. Work with persons. I do recognize the provisional approval has been sent to the St. George's Cricket Club for their particular items. They work for the proposals, but the one thing I can say is that the entry requirements at this point in time will be SafeKey.
Okay. We have a race to Bermuda, the 2021 Spirit of Bermuda Charity Rally that's going to come here, well, starting in the U.S. on June 18th, and then they'll leave on the 27th of June. This will be the second international event authorized, but some sporting bodies in Bermuda can't get a simple answer from authorities to get approval to host a simple event in Bermuda. Where is the miscommunication coming from?
I have no idea where the miscommunication is coming from, Earl, but if there's sporting bodies that are having challenges, the best place for them to take it up with the Minister of Youth, Culture, and Sport. And I'm certain that he'll be happy to sit down with the interview with Island Stats to talk about all the things that are taking place on local sports. But the Minister of Youth, Culture, and Sport will be the best person. I don't have the specific details on all the various sporting events that take place. We are focusing at this level on the broad policy matters, but if there's specifics, certainly they can be taken up with the Minister of Youth, Culture, and Sport. And I know that he'll be happy to come on Island Stats for a long and extended discussion.
Well, he'll be on tomorrow night at 8 o'clock.
There you go. So you can ask the question then. Look at that.
But everybody,
I guess he's going to be warmed up for the. Be careful. Michael is very quick, so he'll make sure you get your last question. Make sure it's a good one.
Yeah. Okay, so you're talking about the SafeKey, right? How does a sporting body, in order to run an event, obtain a SafeKey?
An organization to run an event, they're not issued to organizations. So I just want to make this clear. It gives me an excellent chance, just like the questions that were asked last week. An organization is not issued a SafeKey. SafeKeys are issued to individuals. Individuals, whether or not they are fully immunized, or individuals who can prove that they had a negative test within the last 72 hours. So if you go to Bull's Head, you go online, book an appointment to Bull's Head, you go walk in at Penno's Wharf or Star of India, you will go ahead and get a test. If you test negative, as everyone did today, and you will get an email with your negative test results, and you'll be issued a SafeKey. Any person, including you right now or Basin, can go on your phone, verify.gov.bm, pull up the app, and scan someone else's thing. So the way to get it is it's issued to an individual. But any person, so for instance, when we get to the place we're organizing events, large events, for instance, the Bermuda Day, the Bermuda Day Marathon Derby, which is going to take place on Friday. Anyone can go ahead and scan and verify any SafeKey that is issued by going to verify.gov.bm. So no one has to be issued anything specifically. Any organization can use it. As I gave an example last week, moving to phase 3, if you may be at home and you may want to invite people over to your home, but you may have a family member who cannot be vaccinated and is someone who may have a pre-existing condition that will make them very susceptible to the coronavirus disease if they were to contract the coronavirus, that you can basically say, I would like everyone who comes to my house to have a SafeKey. And you can do that, and you can pull out your phone. Anyone can go to verify.gov.bm. So this is decentralized, it is open, there is no central app that anyone has to use, no organization. Any restaurants in the country right now can basically say, we're open for indoor dining, and every person who comes in, verify.gov.bm, they can check against their ID, and they're good to go.
Okay.
Well, thank you very much.
All right.
Okay, you have a good evening. Okay, next up is Maya Palacio.
Good evening,
Maya. You're live, and you can begin your 4 questions.
Thank you. Good evening, everyone. Maya Palacio here from Media Maya. My first question, Honorable Premier, you answered Dawn's first question about St. Regis and the optics by stating that those persons who are around you were immunized. How do you know that those persons were immunized if you said the vaccination status does not show on the SafeKey?
I'll try it again. Because it was a SafeKey event, what we had to do was to issue SafeKeys. There's 2 ways to get SafeKeys, either negative tests or being fully immunized. We had the attendance list. We issued the SafeKeys to people out of the system. Those persons were immunized. That's how we know that they were. So I accept what people are trying to say in regards to SafeKey. That's the answer to the question on that specific instance. So that's it. But one thing I would like to say, Ms. Palacio, I want to say well done on that video that you did last week. Even though it was the QP code, all the rest, it was a very informative video. Well done.
Thank you very much. Okay, so thank you for that clarity on the persons who were there at that event. Great. My next question is actually more of a request, if you're able to do so. I know most people probably learn visually, and I was wondering, because you have your iPad there in front of you, if you can pull up your SafeKey and actually use your phone, scan it with verify.gov.bm, and show the public that it does not show the expiration date. Could you possibly do that right now for us?
I promise you I can, because I don't have my SafeKey in front of me, so I can't do that.
You can't bring it up on the iPad or on your email?
I'm not going to try and do that live right now. No, sorry.
Okay, no problem. Thank you. I just wanted to request it and see if you could.
No problem.
I will say, though, that I have scanned the SafeKey and it does show the expiration date. So that's why I was hoping to clarify it tonight to see that it does not.
So I'm sorry, what are you asking to clarify?
That when you scan it using verify.gov.bm, that it does not show when it expires.
It does show when it expires. Yes, it does.
Okay. Earlier tonight, you said it shows your initials, your name, date, and then a tick saying that verified.
Ah, got you. That was an error. Yes, it shows basically what is on the paper document comes up inside of the thing. So the paper document has your initials, your thing, and the expiry date, and that's the same thing that comes up when you scan it.
Okay. And then I
Yes. I'm sorry if that was missing or if I skipped over to my text. My apologies. But when you scan it, the QR code encodes exactly what is written on there.
My last question about the SafeKey would be that because, vaccinated people have an expiration date of June 15th and unvaccinated people have an expiration of 3 days, when the SafeKey is scanned, it is visible. So wouldn't it be easy to tell just by scanning it that, okay, this person is vaccinated and this person is not vaccinated just because of the expiration date? So wouldn't that kind of...
I think you might have asked the question. I think you might have asked the question last week, and the answer technically is yes. But as we judge in the implementation of it, you have to understand that's right now. the expiration dates are not always going to be June 15th. We're not just planning on using it just for this time period. So as time goes on, when the certificates are issued for differing time periods and all the rest, there'll be different things that you can't tell. Right now, yes, it will be possible to tell. I will admit that. But the fact is, we went through the elimination of the expiry date on it. But then the question is, how does someone know that there's an expiry date, or when their thing is issued, how they know that it expires? When do they know that it expires? If you follow what I'm saying, and you need to be able to know, because if it doesn't go, and if it doesn't scan, if it doesn't show, then you'll never know when it expires. So we did discuss that issue, but we felt that this was the best way to implement what it is we want. So I accept what you're saying, that yes, it is technically possible in the comparison now in the early times, but when we get to, say, for instance, June 11th or June 12th, people will be getting things that are dated on June 16th, June 17th as it passes. When we get further out, the dates are going to be changed because everyone got immunized on different days. So it's not always going to be that way, but I can accept what it is that you're saying right now. However, the fact is that there is no difference in access between whatever you have, and you do not require to be immunized. You don't have to have a vaccine in order to go ahead and get tested. Make sure that you're clear so you can go ahead and watch Champions League this weekend.
Thank you very much. And my final question is, last year, the Minister of Labor announced that about 70 jobs were being taken off of the work permit to Bermuda, an effort to preserve working for Bermudians, like the work of Bermudians. That initiative expired in April, and I was wondering, did the government extend that initiative, or can foreign workers now apply for those jobs that were once canceled or closed?
Thank you, Ms. Palacio. The Minister of Labor held a press conference where he announced not only the extension of that, but I think the addition of a couple more work categories to the work permit categories. So yes, it was extended, and I think that one or two additional categories was added.
And a follow-up about St. Regis, actually, what deal did the government strike with St. Regis when it comes to hiring Bermudians? Is there a contract stating that they have to hire a specific amount of Bermudians today?
You might be over your questions, but I'll happily answer it, but that will certainly be the last one. It's not a question of a deal that was struck with St. Regis, where we inherited the government. We inherited an agreement that was made between the government of Bermuda and contracts exists. And the Master Development Agreement, which was signed, granted the St. Regis Hotel 137 work permits. Thus far, 90 have been requested. There's 140 full-time staff at the St. Regis, and there are 50. That was something that I confirmed when I was asked on social media this weekend. But the fact is that it is a new hotel opening. It is something that needs to be celebrated. And I think to understand the magnitude of having a St. Regis Hotel open here in Bermuda, being able to be completed on time, on budget through a pandemic and through hurricanes, to be able to provide employment to so many is certainly something that should be celebrated. And the luxury of that destination is something that needs to make sure we have training. And so there are people who are brought in from other luxury hotels that are understanding of that standard. And as time goes on, the Minister of Labor has a plan at the government. The percentage of work permit holders will decrease, the percentage of Bermudians will increase. And we are confident that we'll execute on that plan and continuing to work in partnership with the St. Regis Hotel, hotels in Bermuda.
Thank you very much.
Thank you, Maya. Have a good evening. Okay, next up is Gareth Finnegan. Just taking a while here to connect. Gareth, can you hear me?
Yeah, I'm here, Michael.
Okay, I can't see your video though.
Oops. Ooh. Hang on a sec. Yep.
It appears your camera is not working, but I guess we should proceed. You can go ahead with your 4 questions, Gareth.
Thanks so much, Michael. Good evening, Minister. Good evening, Premier. First question is for the Health Minister. Tonight you mentioned that Bermuda is donating 9,000 doses of the vaccine to Trinidad and Tobago, and you described that as a win-win for both countries. Why is it a win for Bermuda?
I would say it's a win for Bermuda because it allows us to demonstrate our humanitarian psyche. As Bermudians, we are accustomed to trying to do what we can to assist those persons that are found themselves in a more vulnerable, less fortunate position than Bermuda. As the Premier indicated, we are blessed in this country to have been able to receive quite a big supply of Pfizer through the United Kingdom, as well as the government's purchase of AstraZeneca through the COVAX facility. And the fact of the matter is we did not want to have any wastage with respect to the AstraZeneca, and it would have expired at the end of the month. So the win-win for Bermuda is that we were able to demonstrate our humanity for mankind by demonstrating that we can supply that particular stock of Pfizer rather than at waste to a country that unfortunately hasn't been as fortunate as blessed as we've been.
Sure, but isn't it a case of, right, okay, this is going to go to waste, so, you know, let's pass it on to somebody else. It's not really a case of being humanitarian. It's right, okay, you know, we might as well give it to somebody else if we can't use it ourselves.
If you don't call that humanitarian, I'm not sure. Perhaps we have different definition as a humanitarian. I guess we could have just let it waste.
Okay. Second question, which again is for the Health Minister or perhaps the CMO. Again, this evening, the Premier alluded to dangerous variants of COVID-19 entering Bermuda, and particularly the Indian variant. How confident are you that we're protected, that it's not going to come into the country?
Well, I think before the CMO answers, CMO, you would know, Garrett, that we have the way that the variants in any COVID enters into Bermuda is obviously through our borders, and Bermuda has a very, very strict adherence to border protection. And by that, we mean that persons that are non-resident of Bermuda are required to have a pre-test before entry. All persons that land in Bermuda are required to have a test on arrival. It's a nasopharyngeal, which you'd appreciate is the gold standard for testing. And then they continue with the testing regime on day 4, day 8, and day 14. So we do have a very aggressive testing regime. And the fact of the matter is it will help us as best as possible to eliminate importation of a variant or any COVID through our borders because of our testing regime.
But it has spread though, hasn't it? It's gone into the UK, it's gone into the US. You know, it could come here, couldn't it?
Of course, the only way we could actually ever eliminate importation of COVID into Bermuda is to close the airport. And I'm certain that nobody wants to see the detrimental economic impact on Bermuda yet again if we have to close our airport. What we're doing is taking a mitigation strategy and saying, fine, we need to continue to have operations. We need our airport to be open. So in order to minimize the impact of the prospects of importation of COVID, we will adopt a very aggressive testing regime.
It's kind of a balancing act, isn't it?
Absolutely correct.
Yeah. Okay, third question. Can we have a breakdown of the people who've died from COVID-19 in terms of how many were vaccinated, how many weren't vaccinated or had one vaccine or 2 doses? I know you've provided some stats on that, but any more details?
I'll yield to the CMO and or Dr. Miller. Yes, you're right. We provided stats on that, I think last week, but one of them may be able to provide further details concerning that.
Okay, thank you, Minister.
Hello.
Sorry, that is your final question?
Michael, they were supplementaries. I have one more question.
I'm pretty sure that was your last one. But as always, Garrett, if you would like to know something further, you can shoot me an email, you have it, and I would endeavor to make sure that you get a response as soon as possible.
Okay, thank you, Michael. And thank you, Premier.
We are going to get the answers to the question, yes, sir?
In terms of people being completely immunized, none of the people who died from COVID-19 or COVID-19 related were fully immunized. There was one individual who had a second dose, but that individual was not completely immunized. And in fact, in retrospect, that individual had COVID when the individual received that dose. But there was nobody who had 2 doses plus 2 weeks, because that's a requirement. So the simple answer is 0. And it takes us to the important point that if you're fully immunized, even if you were to get COVID, you certainly don't die from it. And that's a remarkable fact. It has performed better than we could ordinarily expect. And it is for that reason that I would encourage people to go out and get vaccinated.
Dr. Miller, when you say fully immunized, what do you mean by that?
Fully immunized means that you have 2 doses of the vaccine plus 2 weeks. You see how the vaccine works is that it takes some time to achieve the full effect. So if, for instance, you had, say, the Pfizer, and you had 1 dose, then 3 weeks later, you had the second dose, you couldn't go someplace the day after that and say, oh, I've had 2 doses, so I'm fully immunized. You would still need to have a lag period of 2 weeks minimum after that last dose to be considered as fully immunized.
But when you say fully immunized, you're not talking about fully immunized, are you? You're talking about 95% immunized.
Well, put it this way, that's, you're speaking of a different question, or you're fully immunized. The next question you're talking about is in terms of effectiveness, which is a slightly different issue. But
Sure.
Fully immunized, the definition is absolutely clear. It's 2 doses plus a clear 2 weeks.
Thank you, Dr.
Thank you very much, Gareth. That was your final.
Thank you, Michael.
Okay, have a good evening.
You too.
Up next is Trevor. Trevor Lindsay.
Good evening.
Good evening, Trevor, and welcome. You're live and you can begin your 4 questions.
Premier, my first question is for you. Last week I made mention of a question, and let me bring it on record. For the record, you did state the following regarding the 14-day non-vaccination quarantine at the press conference on Thursday, May the 14th, as you did make mention to address the topic. You would address it the following Tuesday, which was last Tuesday. And I quote, the cabinet will consider, your words, Premier, the cabinet will consider final consideration will make the final announcement regarding supervised and unsupervised quarantine at our press conference on Tuesday, which was last Tuesday. There is still feedback on certain things that we want to consider and ensure we address every concern, and a quote. Last week, you did state that you never made mention and you was not going to change anything. Can you reply officially today?
Sure, I can reply, Trevor. I'll just refer to you what I said in my remarks earlier today when I gave my speech. I said that we will keep working on the operational aspects of this policy, and will do so sensibly, prudently, in the best interest of the people and the economic recovery so desperately needed. So the operational aspects are still certainly being worked on, but the government is not in any way, shape, or form residing from the position of the fact that we must protect this country from dangerous variants. What I know that everyone in this country agrees that we cannot do what we've done for the last 3 months again. The healthcare system cannot handle it. The hospital cannot handle it. Our economy cannot handle it. Our mental health cannot handle it. And it is the responsibility of the government to take strong and decisive action to make sure we do it. And so my thing is moving beyond the pandemic, and we will take the strong and decisive action that is necessary to move beyond the pandemic. I addressed the question in your remarks, in my remarks earlier today. And so that is the position of the government. And so from that perspective, we are united in the fact that we must do what is necessary so that we do not have to do this again, so we can move back and move beyond the pandemic and reclaim our normality.
Cheers. My next question, Premier. What if a person who is not vaccinated has returned from overseas trip, pays their $3,000, $4,000, $5,000 at whatever facility, their 2-week mandatory stay at whatever facility? What happens if they test positive on the 14th day at that facility? Will they have to repay another $3,000 or whatever amount and another 14 days?
I can answer the question that they will not have to pay an additional amount. That much I can tell you right now.
Again, this was coming
just right now. If someone travels from overseas and they test positive, they have to extend their stay in a hotel. The hotel doesn't charge anything.
Sure, they're listening. My next question, Premier, with SafeKey coming into effect, does this mean that it is going to be mandatory for restaurant staff to be vaccinated? One, two-part question. That's A. And B, what are tourists going to do that's going to want to eat at our facilities? Will they be, and they will be vaccinated, will they have access to this SafeKey system?
Thank you for the questions. The first one is that there is no requirement for employees to be vaccinated. And remember, what this is about high risk activities with the removal of masks. Restaurant employees will have their masks on and keep their masks on while they are working in that environment, as clearly it would be a mixed environment. I think what's important to note, Trevor, is that thank you for asking the question about tourists. It's something that we had mentioned. Remember, SafeKey is issued to persons with a negative test result as well. And so persons who are traveling to the island who are eligible to receive a SafeKey will certainly get one when they get their negative email as well, so they can take advantage of the indoor dining that is available to them.
Thank you. And my last question, Premier, we are now in the second year of this pandemic with many still unemployed and even longer since your administration took over, which was promised price control in your election platform, price control, a livable wage, amongst things including putting some real teeth in our consumer affairs legislation. What do you say to the constituents that are still without work, who are now who are not receiving benefits? What is your plan to address this high cost of food prices in Bermuda? The finance minister said yesterday that he would raise the issue today in cabinet. Was there any discussion? And what action will you take on these issues that we are all facing in Bermuda?
Trevor, thank you for the question. I would not agree with you insofar as that we have not delivered on the items which were laid out in our 2017 election manifesto about granting more powers to the Price Control Commission. The Price Control Commission is led by an avid champion of these matters. This is the Deputy Speaker of the House, MP Derek Burgess, and I'm sure he'll be happy to sit down with you to discuss the matters of which his Cost of Living Commission continue to work on. On a broader level, Trevor, insofar as speaking to your issue, I heard your question last night to the Minister of Finance. I'm not going to discuss specifically what was discussed in cabinet, as that would violate my oath. But what I can say is that we can refer to the economic recovery plan, which there is going to be debate in the House of Assembly. And And the economic recovery plan is not just touching on matters of the economy, but they're also touching on matters which are vital for our social fabric, speaking on issues regarding domestic food production, increased food security, and the reduction of costs, speaking on matters of increasing of affordable housing and building more affordable housing in the country to make sure we meet our affordable housing stocks. There will be a debate in the House Assembly of that on June 4th. But what I can say is that we have made progress, Trevor. There is no question that we've made progress, but there is no question that there is still significant work to do. The government is certainly committed to that work. So what I would say is that there's progress of which we've made. We have executed on a number of our election promises. No one planned for a pandemic. It is a challenge that this pandemic has thrown up in front of us. But at the same time, when you say a person's not receiving benefits, this government not only introduced unemployment benefits, not only expanded financial assistance, we introduced a supplementary unemployment benefit. We provided assistance to businesses to make sure they can cover the expenses, such as payroll, health insurance expenses of their staff while they're unable to work. There's a significant amount of help and assistance of which we have given. There is more work to be done, and I would urge you certainly to report on the debates in the House Assembly in June 4th, but also when you speak, to invite you to reach out to Deputy Speaker Burgess so you can learn more about the work of which the Cost of Living Commission is doing, because we did keep that promise to make sure that we would expand their powers of investigation, et cetera.
My supplementary to your statement, Premier, is that there are many seniors that have homes that cannot afford groceries. And what do you say to comfort these people? There are many people that are struggling. Taxi drivers that are not making money, and the food prices are ridiculous.
Trevor, what I would say is that I accept precisely what it is that you're saying, because remember, Trevor, the Progressive Labor Party is made up of people who canvass, and we canvass regularly. We are on the doorsteps. We hear what is being said. When we're not on the doorsteps, we have Zoom clinics where we hear these things, so we understand. But at the same time, what you have to understand is that we have provided assistance. So you're talking about seniors who own homes. There are people who own homes which were ineligible for supplementary unemployment benefits before, who we have made eligible for those unemployment benefits, who we have made sure that we provide health insurance as well. So yes, there are challenges, but it would not be correct to say that the government has not done anything. And so for individuals who find themselves in this position, they are welcome to certainly reach out. They are welcome to certainly to contact their MPs, because that is our job to make sure that we find the assistance, the help which is necessary and required. So thank you very much, Trevor.
Yeah, thank you very much, Trevor. Have a good evening. All right, Premier, that was the final question asked.
Thank you very much. One thing that I would certainly like to share before we go off the air, because there was a question that was certainly asked earlier in regards to whether or not it's charitable for the country to give away its supplies. And there are other options, because the fact is that we could have sold these vaccines, and certainly people would have bought them. There's no question. But I want to share with the country something that I received today from the Honorable Prime Minister of Trinidad and Tobago, Dr. Keith Christopher Rowley. And it is dated May 25th. And he says, "Dear Premier, I write to express my deepest appreciation to the government and people of Bermuda for their generous donation of 9,000 COVID-19 vaccines to the people of Trinidad and Tobago. Your act of generosity was most timely, as Trinidad and Tobago, along with so many other countries, continues to endure against the challenges created by the COVID-19 pandemic. This act emphasizes the strength of our relationship with the Caribbean and epitomizes Caribbean integration and solidarity. Together, let us continue to advocate for vaccine equity and equality. Trinidad and Tobago remains in your debt for this humanitarian act. Please convey my warmest regards to the government and people of Bermuda, and let them know that they will always remain with us in our hearts." That is what the response of the government of the Trinidad and Tobago is. And so I am proud of this government, and I am proud of the team at the Ministry of Health, led by the Chief Medical Officer and the Minister of Health, who negotiated this and made sure we were able to provide assistance to this country in their time of need. The scenes in Trinidad are devastating, and they're an example of what happens when you have the importation of a dangerous variant which they're battling. And just like we gave to St. Vincent and the Grenadines, also have their own challenges, but still gave some of their vaccine supply to Trinidad and Tobago because we have to help our neighbors. In this country, we have been helping our neighbors here in Bermuda. We have been helping our neighbors regionally. Remember what we did for Bahamas when it was a hurricane. We know that this is the type of stuff in which we do, and the government of Bermuda is proud to continue this effort. So I bristle at any suggestion that this is not a humanitarian act, because without question, it certainly is a humanitarian act. So Dr. Miller, you've got no questions, but I want to thank your team. You're down to 2 persons in the hospital, and I want to thank certainly your team at the hospital's board for the incredible work which they're doing. Dr. Aya, you look a little bit rested. I think things are a little bit less stressful for your team, but please convey the thanks and appreciation to your team from myself and the people of Bermuda. And Minister Wilson, I know that you've been through certainly a lot. Clearly, we are in a better space, and certainly we look forward to next week where we're going to be able to, fingers crossed, as we continue to progress, announce the details of phase 3, which will come into effect on June 6th. So for the people of Bermuda, thank you for your attention. Please feel free to send and share any questions which you may have. Premier@gov.bm is open. The government of Bermuda is able to be contacted, and we continue to do our best to work as this country moves beyond the pandemic. So with that, I want to say thank you, Bermuda, and good night.